everyone, so let's move towards our today's topic, which is...
Now, we have already discussed the development of tongue, we have already discussed the development of palate, we have already discussed the development of eyes, ears. These all topics we have discussed in a separate lecture. But in this lecture, we will only talk about the development of nose and the lips, which are very much important. Okay, so what happened? Facial development occurs during the 4th week till 8th week of human development. So on the uppermost region of the embryo, obviously that will form the face, scalp, brain, and so on. So on that region, 5 prominence will appear. Okay, one prominence which is very large prominence, that is frontonasal prominence. Okay, that will form nose, cheeks, and so on. Not cheeks, but nose, eyes, ears, and so on. And if I talk about the other prominences, so 2 maxillary prominence will be developed and 2 mandibular prominence will develop. Mandibular prominence will form lower lip, okay, and chin, and the maxillary prominence will form upper lip and the cheek. Okay, now moving further, nose की development कैसे होती है? Now at the end of 4th week, what happened? On the inferior side of the frontonasal prominence, 2 elevation appears, and those elevations are nasal placodes. Okay, and on that nasal placode, a depression will arise. That depression is called as nasal pit. Nasal pit will form nostril in the future, and due to their nasal pits, the elevation which are present on each side of the nasal pit, those elevations are lateral wall and the medial wall. Now the point which I have forgot to tell you, that the nasal placodes are present on the inferior side of the frontonasal prominence, but the point which is very important, that these nasal placodes are present on each side of the frontonasal prominence. Okay, and after some time, those nasal placodes will come together and they will fuse. The fusion is between the medial wall and the medial wall of the both the nostrils, nasal pits. Okay, जो nasal placodes दोनों एक हर साइड पे nasal placode है, तो हर साइड पे medial wall भी है, lateral wall भी है, तो दोनों nasal placode के जो medial wall है वो बीच में आके fuse करेंगे, and that will form nasal septum or in future, and the lateral wall will form, the nasal septum will form by the medial wall, by the fusion of the medial wall of both the nasal placodes. Okay, and obviously lateral wall will form, lateral wall of the nose in future. Now as soon as the fusion between the medial wall of both the nostril occurs, what happens? A segment is formed, and that segment is called as intermaxillary segment. Now that segment, the intermaxillary segment, will form upper lip, as well as it will help in the formation of upper lip and the gums which are present on the upper part of the mouth. Okay, so those gums and that upper lip will be formed by the intermaxillary segment. On that time, the lateral wall will also form a continuation with the maxillary prominence, and obviously, as you know, maxillary prominence will form the cheeks. It will also contribute some part to the upper lip as well. Now if you see the upper lip, if you see your face in a mirror, and then you will see that your upper lip has a depression in the middle line. In the middle, the upper lip has a depression, and that depression is called as philtrum. Okay, so this point which is very much important, that philtrum, this depression of the upper lip is called as philtrum. Now lower lip. Now lower lip is formed by mandibular prominence. The mandibular prominence is present on the ventral part of the embryo, and that mandibular prominence is due to the formation of mandibular bone, and that will form chin, and that will form also lower lip as well. Okay, so this was the whole topic regarding the development of nose and the lips. Again, I am repeating this point that we have discussed development of ears, eyes, tongue, soft palate, hard palate in a separate lecture. So in the development of face, all these things are present. Obviously at the end, as you know, that at the end of fifth week, ears will form. Okay, at the end of 6th week, further development will form. So those development, eyes will form, ears will form. Okay, so those development are discussed in a separate lecture, and you have to understand that properly by watching that lecture. So till then, work hard, study hard, and good luck. Take care. Bye bye. Thank you.